You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of breast surgery. My first guest is Beverly Hills plastic surgeon, getting a lot of attention lately because of the results he's getting with his patients, Dr. Ryan Stanton. Dr. Stanton, welcome to the program.
Thank you so much.
Now, before we get into today's topic, tell us a little bit about your practice.
I love my practice, actually. It's so varied, and for me, variety is the spice of life. I have young patients, older patients, everything in between. I'm an owner and operator of a full-service plastic surgery, outpatient surgery center.
Okay, now it's in Beverly Hills.
Yeah, right.
How long have you been there?
Going on 8 years now.
So what kind of patients? You know, we've invited you on the program to talk about breast surgery, but I guess as a board-certified plastic surgeon, you do just about everything?
Yeah, I do everything from head to toe. Keeps me, you know, on my toes, if you will, staying in touch with what's the latest on every technique, because a lot of times patients that come in for maybe one of my specialties also at the same time want a combination procedure that is another part of the body, so I can do them both at the same time. It's really convenient.
So you do facelifts?
Do facelifts.
Let's go over the list. You do facelifts?
I do facelifts, yes. I do nose surgery, rhinoplasty. I do a lot of eyelid surgery. It's one of my specialties. I do a lot of neck contouring and shaping, moving down the body. I do tons and tons of breast enhancement and breast reconstructive procedures such as breast lifts, redos, things we're going to talk about today.
Okay.
I do a lot of liposuction, tummy tucks. One of my other specialties besides the breast is buttock augmentation.
Yeah, buttock augmentation.
Yeah, it's very popular.
About that. You said you're one of the busiest guys doing this.
Yeah, I'd say so.
Is it a popular procedure? So it's kind of a butt implant?
Yeah.
For somebody with a flattened area, like a flattened...
Yeah, most of the patients have, you know, the lack of a sway or step off between their lower back and their butt. They want more fullness there. But some patients have a good shape, they just want more.
Is that right?
Sometimes a little bit is never enough, and as human beings, sometimes we're a little greedy, and more is better, and patients are usually happy.
What do you put in there? I mean, what kind of an implant is it?
It's similar to the breast implant, but the buttock implant, by FDA standards, cannot be silicone gel. So it's a very soft, semi-solid silicone rubber implant.
So is it becoming a popular procedure?
It's so popular that even some celebrities are having it done nowadays.
Is that right?
Yeah.
Okay. Now you have a celebrity following.
I sure do, yeah. Well, I'm in the heart of LA and Hollywood, Beverly Hills right next door. So
how do they hear about you? They just kind of word of mouth?
Well, it could be anything from a news program to a lot of times referral based. You know, these patients are very private. Some of them are okay with it being out in the open, but most are very private, so they talk among themselves. And that's how I get most of the referrals. Okay,
breast augmentation. Is that the most popular of all cosmetic surgery or plastic surgery procedures, or is it liposuction?
No, in the world of, well, especially with women, in the world of cosmetic or plastic surgery, breast augmentation is still king.
It is mainstream now, it seems.
Oh, I would say in the U.S. alone, over 350,000 women get their breasts augmented each year. Okay,
is there art to it? Because it seems very straightforward. I don't pretend to understand it completely, but it seems straightforward.
Well, at the basic level, it is straightforward. You put an implant in to augment the breast. But if you approach it that way, you'll just make a bigger breast. The idea is to make a bigger, fuller, more beautiful, better shaped breast with more cleavage that's teardrop shaped, that looks sexy in clothes, bikinis, and with no clothes on.
So what's new, by the way? Anything new in the world of breast augmentation?
There's always things new. The silicone implants are better now. They have more shapes available. We have shapes to give more of a natural look to the breast before they're kind of flat and pancakey.
So you say they're more, it's a projection, like a projection type of an implant?
Yeah, before we used to have really kind of flat silicone implants or over projected like torpedo shaped implants. Now they came up with something kind of parabolic right in between, which I think, and a lot of my colleagues think, looks the best.
All right. Now, what about you know, textured versus smooth?
Yeah, that's always the question: textured versus smooth. I would tell you that 90% of us that do a lot of these augmentations just use smooth. The only reason really to use texture is on a breast reconstruction sometimes, or if for some reason you're having to put the implant on top of the muscle, which is most of the time not advisable.
Okay, what are the different categories of breast patients that you see?
Well, the age range is all the way from 18 through the 60s, if you will.
Is that right? In their 60s, women?
Well, you never know. Some women have a new spice on life after, who knows, a divorce later on.
50, 60 is young today. There's no doubt about that.
Well, with all the anti-aging clinics out there, 50, 60 is very young. So women maybe for the first time are getting their chance to do something about their body, and it could be at the age of 60.
Now for the enlargement, the augmentation, are they getting younger and younger or older and older?
I think I'd have to answer yes to both of those questions.
Okay.
We have patients, for example, for high school graduation, just turning 18.
Is that right? Very common. Parents will do that.
Yeah, it happens, absolutely. And then I have the older patient range that could be in their 60s. Finally have opportunity in their life.
Is that more of a lift or just an augmentation?
Well, it could be either. You know, patients that have big breasts, even if they're in their 30s, may need a lift, or 60s. If you're in your 60s but you still have an A-cup breast, you don't need a lift. You know, it kind of depends on what size you're starting with, how many pregnancies you've had, which is another large group of patients, women that have had pregnancies, maybe just one, maybe multiple, where the breasts have expanded and contracted each time. You know, they lose tissue definition, they lose fullness, and they come in with saggy, deflated breasts. They've lost all confidence. They love their children, but what can we do for them? Well, we can lift them up again, make them perky.
So no matter what kind of working out you do, no matter what, breast tissue is just going to fall?
Yeah, that's such a common misperception. Also for tummy tucks, you know. By working out, it tones your muscles, tones your lungs, your heart, your bones. Unfortunately, the one thing it doesn't touch at all is the skin. And skin is a lot of what supports the breast, skin and the ligaments of the breast. So once the skin and the ligaments have been overstretched by volume, whether it's weight gain or pregnancy, and then shrunken back down by weight loss or delivering the baby and so on and so forth, that you cannot, the elasticity has been broken of the skin and the ligaments. The only way you can recreate or refirm things up is through surgery and implants.
Okay, over the muscle, under the muscle, what do you like to do?
Always under the muscle.
Always under?
There's really no good reason.
Are they still doing it? Are surgeons still going over the muscle?
There's some that are believers in over the muscle because they feel it's more of a natural position for the implant because the breast, as it naturally sits, is all on top of the muscle.
Okay.
Okay. The problem is, on top of the muscle, you're supporting the implant with just the breast tissue and the skin, so what happens is it sags over time. Also, the rate of capsular contracture where the implant can turn hard with scar tissue is double or triple when it's on top of the muscle. And thirdly, when the implant's on top of the muscle, you can really see the visible edge of it a lot easier, or rippling, this phenomenon where there's waviness to the skin. So there's three great reasons to go under the muscle, and they're all very important as far as having a beautiful breast.
Now, in Beverly Hills, you know, you're the guy, you're the breast guy in Beverly Hills. How do you get this reputation?
Well, I've only been there for 8 years, but it's all started off slowly. You know, getting a couple patients, doing a good job, referrals, being fortunate enough to be connected with a couple celebrities.
Okay.
You know, a lot of movie people there, and then things kind of snowball. It's all about really attention to detail, doing a good job, and taking care of people afterwards.
Okay, now another thing you do, which I guess to some people might be controversial, is you go through the belly button oftentimes for your implants.
Yeah, that is a procedure where I wish I was the one that thought of it.
Oh, really? Okay,
every time I do it, I think like, whoever thought of this was
like
such a genius. Such a genius. So simple, but such a genius.
But I've had surgeons on this show that say, you know, Randy, I don't know. It's such a distance from the belly button to the pocket of the breast that they feel they can't get control of the implant, even though they admittedly they've never done the procedure.
Yeah.
So what is your
well, that's the key. They've never done the procedure. That's the key. They may be great surgeons, but if you haven't done the procedure, if you haven't trained the procedure, it's tough to evaluate or even be critical of the procedure. Like any procedure we do in the world of surgery, not necessarily plastic surgery, there's instrumentation involved in training. And this procedure, like any other procedure, if you have the right instrumentation and you have the right training.
Can you make them look natural by going through the belly button?
Absolutely. I'm going to prove it to you with some photos.